mics, please. People will turn off their mics. Okay. This is B. Coleman, not a homeopath, but a lover of natural medicine. And boy, have I had a busy couple of weeks, and Easter and watching grandchildren. And I got a mild cold about a month ago, and here I am 1 month later, and I'm still dealing with a cough. I'm gonna need some help with that, people. We also lost a friend of 30 years a week ago. He took the hokey pokey and became a quadriplegic and suffered for 2.5 years until he was finally released from his body. I was asked to sing at his funeral, but this cough made it impossible, and that broke my heart. I am certainly looking forward to less traumatic life events. Anyway, today we're discussing sleep apnea. I didn't think I had much, but I got a little bit. Joette Calabrese, she simply says Sanguinaria 200C twice a day. That's it, that's all. And she states that Sanguinaria is also a capital choice for a wealth of sinus issues and throat conditions, for snoring, for continual clearing of the throat from dust, burning sensation in the mucous membranes, excessive phlegm, post-nasal drip, or sinus headaches that originate above the right eye. Now, in that article, there was someone who posted a comment that stated that Arsenica malbum 30C worked for their sleep apnea. So there's another option to consider. I have no idea if it works, but she was adamant that it did the job for her. I would do that 3 times a day. Now, for a non-homeopathic option for sleep apnea, there is a video that I watched, and this was a naturopath. This doctor says that sleep apnea is either a nervous system problem or it's obstructive sleep apnea. He has found that in his practice, sleep apnea is a dysfunction of the cerebellum 90+% of the time. This was even for people that had been diagnosed as obstructive. The specific supplement that he recommends is RNA by standard process, and that is ribonucleic acid. Each tablet contains 175 milligrams of RNA per tablet, and most people need somewhere around 6, but it can go as high as 15. It just depends. And as always, I recommend muscle testing and spread out the doses. Like if you are taking 6 of them, then take 2-3 times a day, and so on. He also recommends that we avoid sugar, carbs, and grains because they inflame the brain. Excuse me. Now, for those of you with remedy makers, I found a rate for RNA in the Bionetics rate chart. And so that would be base 10. The rate is 862,944. As always, you have to decide on the frequency and the potency because they don't provide that. Does it work as well as a supplement? I have no idea. All we can do is try it if we like it. It's a very cheap way to go if you don't want to spend the money on standard process supplements. The next one I got from the Banerjee Clinic via email, and it has 3 remedies. They are taken separately. Tecurium marum verum. It's usually known as Tecurium mar. Tecurium is spelled Teucrium, mar, M-A-R. This is in 1 m, and it's taken once every 10 days. The second one is Sanguinaria 200C, twice a day, morning and evening. And the last one on that one is Ignatia amara, 200C, twice a day, noon and night. And remember, these are taken separately. And finally, for those with a remedy maker, again, there is a base 10 rate for a remedy in the Yvonne Combe, C-O-M-B-E. I'm sorry about that. This is in the Yvonne rate comb chart. It is simply called sleep apnea, and the rate is 12244. Again, 12244. And again, you'll have to select your potency and dosage frequency. And that is all I have for you guys today. Does anyone have any questions? If there are no questions, I would like to welcome Ahava to come up and speak to us next.
Thank you, B. I'm so sorry to hear about your friend's passing. That is incredibly sad. I'm so sorry. I hope you are able to find some peace in the situation. I am Ahava McLaughlin, and I'm a traditional naturopath from South Florida. And I'm going to talk a little bit from a naturopathic perspective, sleep apnea. And then we look forward to Dr. Imran and his wonderful protocols that he's going to share with us today. Okay, so sleep apnea, really it's boils down to one thing, and that is weight loss. For those that are overweight, this is the majority of the population that sleep apnea is affecting. And that it's very important to lose the weight. So I have seen clients when they lose weight, the sleep apnea goes. So, that is going to be critical to key to long-term success, right? And obviously we need to see what's holding the person back from losing weight, and obviously supporting them through the condition until they are able to get to that point where the sleep apnea is able to go. So we want to look at different things like making sure that one is eating a high fiber diet, eating healthy fats and proteins, limiting the sugars, getting down to the nitty-gritty of why is someone overeating? Maybe there's a traumatic experience. Dealing with it, having it face on is going to be really important. Adaptogenic herbs like maca, ginseng, and rhodiola can help control these conditions that make it hard to lose weight. Lots of high stress is a contributing factor that affects your thyroid, which affects your weight. That's a good point, actually. The weight is cross messaging. A lot of people think, oh, the digestion, which is true, but really, when it becomes stubborn to lose the weight, we want to look at the brain. The brain is where it's sending the messages, and the messages are getting crossed. And that is in the hypothalamus as well as in the pituitary gland, which we know the pituitary controls the thyroid, for example, and the adrenals. So that whole endocrine system should be looked at. And starting with the messaging of the brain, there are comprehensive homeopathy products that do rewire that part of the brain and help correct the messaging signals. And Professional Formulas has a beautiful product on this. It's called actually hypothalamus pituitary adrenal. And that over a long period of time, I would say like at least 3-4 months, taking it every day can be helpful. They also have another product called weight management that is also comprehensive homeopathy, and that helps with the in-moment cravings and the immediate weight loss, from a homeopathic perspective. Now,
Excuse
yeah,
me. I've got a couple of people that need to turn their mics off.
okay.
Rita, REDA, your mic is on. And the other one has turned hers off. Okay, I'm sorry.
Okay, perfect. Okay, thank you. Okay, so using herbs and homeopathy together can be really impactful. as well as, making a plan of action for stress levels and traumas and different emotional issues and actively targeting it. Because if you don't do that, it's almost guaranteed that it's not going to work. So that's really, really important to keep in mind. Obviously, if there's smoking and alcohol use or sedative use, that can constrict the airways and not be helpful. Um, a lot of people who suffer from sleep apnea also have issues with chronic coughs or congestion, heartburn, acid reflux. So supporting them through this time can be really helpful. I love slippery elm. It's one of my go-to herbs. It really helps line the whole digestive tract lining, starting from the esophagus here all the way down and through, and that can help with reflux in and of itself. Making sure that you're not eating congested foods, inflammatory foods like, processed dairy or seed oils, obviously sugar, that kind of stuff. So trying to minimize the amount of congestion, and, that could also be allergy related. Do you have mold in your house? Do you have a lot of pet dander that's bothering you? Environmental allergies, right? Like getting a hold of that also can be helpful. Chronic coughs, some people walking around with long haul COVID or even mycoplasma is a it's one of the main culprits for chronic coughs that I see in a lot of clients. And removing the mycoplasma from the lung and respiratory system is going to be critical to also helping calm down. So anything that's going on here in this upper respiratory system, lower respiratory, as well as digestive, the gallbladder being sludged up can also cause, by the way, a lot of sinus issues as well. So looking at the gallbladder is another point to look at. Our gallbladder point is right here on top of this muscle here, and if you have a lot of pain here all the time, you might want to look at your gallbladder and see, you maybe have gallstones and a lot of sludge in there that needs to be looked at. So trying to figure out what the root cause of it is and where it's coming from is going to be also critical, besides losing weight and removing the mycoplasma and or long haul COVID if those are replicating spike proteins happening, or just a lot of inflammation in that track. It will be key to calming things down with the sleep apnea. Okay, so there's like 50 to 70 million Americans who have sleep disorders, and most are over the age of 45. And sleep apnea actually affects more than at least 12 million people to 18 million Americans every year. That's actually a lot of people. So we need to get more information out there for our American friends about getting a hold of their health, I guess. And it can also occur in children, especially if they're overweight. So getting good exercise, running outside, is really going to be really key and critical. Let's see. So I think it's 4 out of every 100 middle-aged men and 2 out of every 100 middle-aged women have sleep apnea with noticeable symptoms. So we see here that men are more highly targeted or have, symptoms of this. They're twice as likely to have sleep apnea than women. Learning how to get a hold of your nervous system, taking deep breaths and how to self-regulate will be really, really helpful as well to get the stress under control so you could start to, get a hold of the health. So those are some things that, I know it's broad spectrum, but I really feel like it really boils down to it's a weight issue at the very core of it. But then, of course, there's other contributing factors. Sleeping a little bit more upright can be helpful. Humidity in the bedroom can also be helpful with the sinuses. Eucalyptus essential oil. Oh, also essential oils like cinnamon. Cinnamon essential oil will be helpful will be helpful for weight loss. Grapefruit essential oil, cinnamon essential oil, and ginger essential oil can help with control the appetite, hormones, and digestive symptoms. Okay, let me see. Symptoms. Symptoms of sleep apnea: waking up suddenly, always feeling like you're tired, snoring loudly, pausing and breathing. Um, uh, Other people are reporting that you're breathing abnormally, waking up with a dry mouth, night sweating, shortness of breath when you're waking up, trouble concentrating, brain fog during the day, more irritable and anxious and depressed than usual, and then also having lower immune function, which make you higher risk for other hormonal imbalances and different ailments. Okay, so I hope that was helpful and informative, and I look forward to hearing what Dr. Imran has to share with us on his protocols today. Thank you.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. Here is Dr. Imran from Pakistan. Today, our topic is sleep apnea. So first, I want to talk about what is the symptoms of sleep apnea. Symptoms of obstructive sleep apnea: excessive dry daytime sleepiness, loud snoring, observe episode of stop breathing during sleep, walking during the night and gasping or choking, awaking in the morning with a dry mouth or sore throat, morning headache, trouble focusing, mood changes such as depression or being easily upset, high blood pressure, decrease interest in sex. So, what is the cause? Obstructive sleep apnea: when the muscles in the back of the throat relax too much to allow for proper breathing. These muscles support the back of the roof of the mouth as the soft plate. The muscles also support the tongue and side walls of the throat. When the muscles relax, the airway narrows or close to you breathe in. This can lower the level of oxygen in the blood and cause a buildup of carbon dioxide. Your brain senses this impaired breathing and briefly you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. You may awaken with shortness of breath that corrects itself quickly within 1 or 2 deep breaths, or you might make a snoring, choking, or gasping sound. So, what is the risk factors? Anyone can develop obstructive sleep apnea. However, certain factors put you an increased risk, including excess weight. Most, but not all people with obstructive sleep apnea are overweight. Fat deposits around the upper airway can obstruct breathing. Medical conditions that are associated with obesity, such as hyperthyroidism and polycystic ovary syndrome, also can cause obstructive sleep apnea. Older age: the risk of obstructive sleep apnea increase as you age, but appear to level off after your 60s and 70s. Narrowed airway: a naturally narrow airway is a trait that can be passed on in your family, or your tonsils might become enlarged and block your airway. High blood pressure, known as hypertension. Obstructive sleep apnea is a relative common in people with hypertension. Chronic nasal congestion, obstructive sleep apnea, twice as often in those who have constant nasal congestions at night, regardless of the cause. Smoking. People who smoke are more likely to have obstructive sleep apnea. Diabetes. Obstructive sleep apnea might be more common in people with diabetes. Male sex. In gentlemen and 2 to 3 times more likely as a premenopausal woman to have obstructive sleep apnea. However, the risk of obstructive sleep apnea increase in women after menopause. A family history for a family history of sleep apnea. Having family member with obstructive sleep apnea might increase your risk. Asthma. Research has found an association between asthma and the risk of obstructive sleep apnea. Now I want to talk some homeopathic remedies which we are common use in our clinical practice. First remedy is Laxis. Lachesis. Laxis is top homeopathic remedy for sleep apnea. Laxis is a natural medicine for sleep apnea where a person wakes up frequently due to obstructive breathing. The person may need to sit up and need to take deep breath. Fear of going to sleep may also prevail among them. Such subjects also cannot tolerate anything tight around their neck like collars. We are use Lexis in 30C, Lexis in 200C, Lexis in 1M according to the patient condition. Next remedy is ammonium carb. Next remedy is ammonium carb. Ammonium 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 carb. Ammonium carb or blocked nose at night, inability to breathe through the nose, walking with starting from sleep, excessive sleepiness during the daytime is also well noted. We are use ammonium carb in 30C, ammonium carb in 200C according to the patient condition. Next remedy is Limna minor. Next remedy is Limna minor. Lemna, Limna, Minor, Limna minor. Limna minor offers help in cases when the symptoms are with stuffed nostril from polyps, foul smells from the nose, thick yellow-white discharge from the nose, and snoring. We are use limna minor in mother tincture, limna minor in 1x, 2x, 3C, limna minor 6C, limna minor 12C, limna minor 30C, limna minor 200C, limna minor 1M according to the patient condition. Next remedy is Sanguinaria. Sanguinaria. Sanguinaria is useful when symptoms include with the dryness of nostrils, yellow bloody mucus discharge from the nose, sneezing, burning in nostrils, desire desire for fresh air, and poor restless sleep, nasal turbinate hypertrophy may be present along with nasal polyps. For using both these remedies, we are use Sanguinaria in 30C, Sanguinaria in 200C, Sanguinaria in 1M, Sanguinaria in 10M, according to the patient condition. Next remedy is Grandelia. Next remedy is Grandelia. Grandelia. Grandelia is a natural homeopathic remedy in asthmatic patient where the person stops breathing while sleep and wakes with the start suddenly. There is a need to sit up to breathe as well as operations felt in the chest with tough. We are used Grandelia in mother tincture in 3C, in 6C, in 30C, in 200C, and in 1M according to the patient condition. Next remedy is opium. OPIUM. Opium for sleep apnea with snoring. Opium is a natural treatment for sleep apnea when a person tends to snore deeply. The person faces spells of stop breathing upon going to sleep and may also feel suffocated, excessive dwarfishness, and sluggishness during the day may be there. We are use opium in 30C, opium in 200C, and opium in 1M according to the patient condition. Next remedy is Sambucus nigra. Sambucus, Sambucus nigra. Next remedy is Sambucus nigra for sleep apnea management in children. Sambucus is an effective remedy for obstructive sleep apnea in children. The child needing Sambucus wake up suddenly during sleep feeling suffocated. He sits up and gasps for breath. The episodes of passes of breathing are repeated several times during sleep. Increased sweating also attend. Nose is dry and obstructed. We are use Sambucus nigra in 3C, Sambucus nigra in 6C, Sambucus nigra in 30C, Sambucus nigra in 200C, according to the patient condition. Next remedy is sulfur. Sulphur. Sulfur is another common homeopathic remedy which helps in curing the sleeping apnea problem. It is most effective in cold people. It helps in preventing the break or inability to sleep at night. We are use sulfur in 30C and sulfur in 200C according to the patient condition. Next remedy is arsenic album. Next remedy is arsenic album. Arsenic album is another homeopathic remedy for preventing the disease of sleep apnea. It reduces the breathing difficulties and reduces the breaks during the sleep. We are use arsenic album in 30C, arsenic album in 200C, and arsenic album in 1M according to the patient condition. Next remedy is Agnatia amara. Ignatia, Agnatia amara. Agnatia is the homeopathic remedy used for curing the sleep apnea. When you have symptoms of sobbing and deep singing, Agnesia is considered as the most effective remedy. Deep singing, respiration can lead to the sleep apnea problem. So if you have deep singing, subbing symptoms, you can take the Agnesia remedy. Agnesia we are used in 30C, in 200C, and in 1M according to the patient condition. Next remedy is Spongia tosta. Spongia, Spongia, tosta, Spongia tosta. This remedy for crop may help congestive sleep apnea suffers as it treats respiratory symptoms that arose when laying down. Before taking these medication, it is important to visit the. So we are use Spongia tosta in 30C and Spongia tosta in 200C according to the patient condition. Now I want to share some homeopathic protocol which we are common use in our clinical practice for sleep apnea. My first protocol is Limna minor 30C, LEMNAMINO, Limna minor in 30C, Tivkram Maram Viram in 30C, and Thuja 30C. Mix together these three remedies and use 3 times a day. If oxygen level is down, if oxygen level is low during the sleep, then we need to use Carboveg 30C and Oxygenum in 30C. Separately, these two remedies 3 times a day.
Are those all part of the first protocol, Dr. Imran? Or is that the second protocol that you just gave us?
Yeah, second one protocol, first protocol, and
Okay.
second protocol if oxygen level is low during the sleep. Then we are use Carboveg 30C and Oxygenum in 30C separately 3 times a day. Okay, so second is if patient is snoring during the sleep and breathing issues, then we are use opium 200C, opium 200C once a day. Okay, so one more protocol for snoring. One more protocol is for snoring. Britacarb 200C and Basilinum in 200C. Mix together these two remedies and take twice a week. Britacarb in 200C and Basilinum 200C. Mix together these two remedies and use twice a week. Then Natramur 6x, Calimere 6x, and Calcarea Floor 6x. Mix together these three cell salts and use 3 times a day. I repeat again one more time. Bretacarb 200C, Basilinum 200C, mix together these two remedies and use twice a week. Then Nectromure in 6x, Calimere in 6x, and Calcarea Floor in 6x. Mix together these three cell salts and use 3 times a day. So one more protocol, if anyone, if patient walking during sleep, if patient walk during the sleep, then we are use Slacia 6x, Califas 6x, Slacia 6x, and Califas 6x. Mix together these two cell salts and use 3 times a day. So one more remedy, if during sleep, fearful dreams, bad dreams, then we are use Slacia 6x 3 times a day. So next protocol is for nightmares. Nectromure 6x, Califas 6x, mix together these two cell salts and use 3 times a day.
Does that just address the night terrors, or does it also address any sleep apnea? Dr. Imran? I think we may have lost him. Dr. Imran, are you on board?
Hello, yes.
Okay, did you hear my question?
Yes, please say again.
On the one for nightmares, does it only address nightmares, or is that also for those with sleep apnea? So it addresses sleep apnea along with nightmares.
No, only nightmares.
Okay, great.
So anyone have a question about this topic? So I'm here to answer.
I do have a question. Um, I've seen several conversations about sleeping with an open mouth. Is that something that causes sleep apnea? And what can we do about sleeping with an open mouth?
Okay, some people have problem if sleep with open mouth, maybe uh, a polyps in nose. So my first protocol, I share limna minor, tucrum, and thuja. These three remedies helping very well.
Say the remedies again.
Limna minor 30C, Thuja 30C, and Deuterum marum virum 30C.
And what if it's not a polyp? Are there, excuse me, are there other reasons that a person might sleep with a mouth open? I know that there are many mornings, and I don't think I have sleep apnea, but I do know that there are many mornings when I wake up and my mouth is really dry.
So we need to find the cause. So if nose block, then we need to give some remedies for nose. So if breathing issues, breathing from nose, breathing from mouth, then we need to add some laxes. Some patient need laxes. Some patient need some Bocus nigra.
Okay, okay,
So but most of the patient must have some issue with nose.
okay.
Some patient have bone issues. Some patient have a dryness in nose. Some patient have polyps in nose.
What about heart issues? I know that if sleep apnea goes on long enough, it can negatively affect the heart. And in fact, I had a woman come to me for help, and she had had sleep apnea for a very long time and didn't even know it. And it was very severe sleep apnea. And I ended up giving her a bunch of remedies, but it apparently was too late because I gave her the remedies on a Saturday, and she died on Monday, and her heart just stopped beating. Uh, is
Okay,
a way, do we try to address heart issues as well?
okay. So listen. So first, if sleep apnea is chronic, then 99% patient issue with oxygen level during the sleep. When oxygen level is down, then they must hit the heart. Then we need to give, first of all, larocerasis, carbovage, oxygenum, crataegus, grandilia. These are top grade remedies. Larocerasis, carbovage, arsenic album, grandilia, and crataegus. These are all top grade remedies according to the symptoms. But we need to must check the oxygen level during the sleep. If oxygen level is down, oxygen level is low, uh, then we must need to give arsenic album, carbovage, and larocerasis. These are the top grade remedies.
Okay, great. Thank you so much.
Okay, welcome. So anyone have another question? Anyone have another question? So I'm here to answer. Okay, I want to say thanks to everyone. Next Sunday, same time, we meet again here with new topic. So thank you very much to all.
Awesome. Thank you so much, Dr. Imran. It's always such a pleasure to learn from you. Thank you.
Thank you so much, Doctor.
Thank you.
Thank you.
And goodbye all, and God bless.